Hi, I'm Dr. Cathy Kim, founder of Integrative Body Medicine and member of the Institute for Functional Medicine and Academy of Integrative Health and Medicine. This video explains how to access the deepest core muscles to elevate the front of the pelvis and help achieve a more neutral pelvis. Let's look at the pelvis, which is shaped like a bowl. Imagine 3 puppet strings attached to our pelvis, 1 low in the front and 2 at the top of the bones in the back. If you were to let go of the back strings, the pelvis would tilt backwards. If you let go of the front string, the pelvis tips forwards. It turns out that when we never access the puppet string in the front, we over-rely on the 2 back strings, otherwise known as the Quadratus Lumborum muscles. Most of us are not even aware that we have the ability to lift the pelvis in the front. So as our deepest muscle, the hip flexor, gets tighter, we let our pelvis rotate anteriorly, dragging our upper torso down with it. So can we learn to lift up this 3rd puppet string? Well, almost everyone has heard of the advice that we need to strengthen our core to support our back, and this is partly accurate. Most people interpret the core to mean the central abdomen, muscles of the rectus abdominis, the classic six-pack. But it turns out that although building up strength in this area can help support the back, it still can't save you from the relentless forward tipping forces of the hip flexor that we explained in the last video. The pelvis will still rotate anteriorly, the rectus just won't let it tip over too far. To stabilize the pelvis and resist the anterior rotation force of this invisible hip flexor, we need to access a second deep invisible muscle group, the pelvic floor, the origin of the true core. Men and women both have the ability to access these muscles, and we do use them to stop our urine stream or hold our urine in when we really need to go. In fact, men and women have been using this for thousands of years to practice yoga. It is called your Mula Bandha, which is Sanskrit for root lock. Isn't that a fitting name for your true core? Many women have already heard of strengthening these muscles in an exercise called Kegels, but traditional teaching advised to do these Kegel exercises repetitively, usually while sitting, such as at stoplights. The limitation with doing these Kegel exercises while seated is that in the end, it's just an exercise that will help you hold your urine better. There's been a shift towards making more exercises more functional so that we can recruit the muscles in the correct sequence to correct our imbalanced mechanics. If we mindfully use our root lock while the pelvis is in motion, then our front puppet string opposes the hip flexor and thus helps stabilize the pelvis. This is now a functional exercise for the pelvic floor muscles that you could potentially do 100 times per day as you enter your car, stand up and sit down at work, put on pants, and open heavy doors. So, rather than do traditional sit-ups for your core, which actually shortens and tightens your hip flexor, try lifting your pelvic floor and holding your pee to activate your deep front puppet string right at the moment that you get up from sitting or as you're sitting down. Most people notice a reduction in back pain during this movement because they are using the front puppet string to reduce strain on the back. As an added bonus, accessing this Mula Bandha recruits other muscles, such as abdominals and thigh muscles, and helps to strengthen them just by living your normal day without even going to the gym. If accessing your root lock makes sense to you and you're wondering what more you can do to help your pelvis move even more towards neutral, please watch my next videos. You can also visit my website, integrativebodymedicine.com, to learn more about my approach to whole body health.